The question as to whether or not people actually need private health insurance gets asked on almost every social media forum and news outlet that I follow. There is a guide which should help most people determine relatively quickly whether or not they actually do need private health insurance, and today I'm going to be going through that with you. Welcome back to my channel. My name is Reese. In today's video, I'm going to try and help you figure out whether or not you need private health insurance. Australia has a universal healthcare system known as Medicare. It's accessible to every Australian citizen and it's funded by Australian taxpayers through a 2% tax known as the Medicare levy. Having access to general practitioners or GPs and hospitals are just two very good examples of the actual healthcare system we have in place. Some people believe that having private health insurance will give them access to better care through the private system, and they fear that they won't get the same level of care or same quality of care through the public system. There are some pitfalls through the public system, and I'll go through a couple of examples right now, and they include things like having to wait long periods of time for elective surgeries and actually having to pay for an ambulance if one gets called out, which, look, if an ambulance is going to save my life, I'm probably going to be okay with paying that fee, but nonetheless, it's still relatively expensive to call out an ambulance. And the big one is that dental care isn't actually on Medicare, so anything to do with your teeth, you're gonna have to pay for it. But back to private health. Every year between March and April, the people who do have private health get a notification that their premiums will be increasing. The cost of having private health insurance is continuously increasing, and it's now starting to be argued that the benefits of having it no longer outweigh the cost, meaning people are paying more than what they're actually getting for that service. Now, there are 3 reasons, in my opinion, which should dictate if you need private health insurance or not for most people. Those 3 things include you having a very serious or expensive illness which can be covered through the private health system. You earn enough money that would require you to pay the Medicare levy surcharge. So once you earn more than $90,000, there is an additional tax that you will need to pay every year unless you have an appropriate level of hospital cover, or you are somewhat impatient and you want to avoid long wait times for elective surgeries, or you want to have access to a doctor of your choice or a hospital of your choice, which I'm just going to say it out loud. If you have the opportunity to do that, there is absolutely nothing wrong with wanting to do that. To keep it short, those are the only 3 reasons I truly believe most people would need to determine whether or not private health insurance would be appropriate for them. Like I said, I personally believe that private health insurance is not worth it unless you fit one of those categories, whether it being you earning too much money where you need to pay the Medicare levy surcharge, or you have a serious illness which can be covered by private health insurance. Growing up, I used the public system extensively. I went through GPs, hospitals, I went through surgeries, and I had a good experience with all of it throughout that time. As good as it could be, it was surgery. Surgery sucks. But the point is that the public system is great for what it is. If you think that you will need private health insurance in the future and are currently financially stable, go for it. It might be worth taking out a cover right now to avoid loading in the future. On top of that, again, if you earn enough to have to pay the Medicare levy surcharge, which at the moment it's $90,000 or more gross income, not after-tax income, again, it probably will be worth taking out a low-end cover to avoid paying the Medicare levy surcharge and $900 just to a tax where you don't really get anything out of it. I actually do this because I earn above the threshold and thus would have to pay the Medicare levy surcharge, and the private health cover that I have taken out I've found to be cheaper than actually paying that surcharge. And out of it, I get a few things like a few teeth cleans throughout the year and an ambulance call, just as a few examples. If you want a simple example of what the Medicare levy surcharge is and how to avoid it and the tips and tricks surrounding it, I've left a link in the description below to the video that I made on that specific topic. If you do decide to take out a private health insurance cover, make sure that you're getting the best deal that works for you. Shop around, look around, and find the deal that is suitable to your needs. I also encourage you to review your policy every year and speak to your health insurance provider to see if they can do anything better than what they're currently doing. Overall, I hope today's video was informative and I hope you enjoyed it. If you did, please consider liking and subscribing, and as always, I will see you in the next one.